Hello everyone, this is Dr. Abhinav. So in this video, we'll be talking about the various aspects of Neet PG exam versus UPSC CMS and ESIC IMO exam. And we'll also talk about the state exams. So to begin with, these exams are of different levels and of different kind. And these three lead your life into different ways. So these three exams are basically not equal to one another and they are basically different. I know it's quite confusing, so I'll explain everything in the upcoming slides. So before we start, if you still haven't subscribed to our channel, please do press the subscribe button below, and you can also check the links in description. There you can find our Telegram group link where we'll be having our discussions. You can join that group also. And yeah, don't forget to subscribe. Now let's start. So to begin with, here I've given the criteria, and in this initially we'll be discussing about the basic exam details. I've written here Neet PG as well as INI-CET, here UPSC CMS and ESIC IMO exam, and the state exams. State exams are basically like MRB exam for Tamil Nadu, KPSC for Karnataka and Haryana. And each state has its own exam and it selects doctors for its states. So those kind of exams I've clumped into separate category. To begin with, the general introduction about these exams. Neet PG INI-CET, we don't need any new introduction because these are well-known national level exams. Neet PG and INI-CET both are conducted by central board, and this is a national level exam. UPSC CMS, ESIC IMO, these two are also conducted by the central board, and these are as well as national level exams. State exams, as the name implies, these are conducted to the state level. However, in certain states, you can apply even if you are from a different state also. For the exam schedule, as we all know, Neet PG, INI-CET, the exam is conducted once per year, whereas UPSC is conducted once per year, but ESIC IMO, it's basically conducted once every 2 years. And the state exams, they are also kind of very irregular. They are not conducted every year, but they will be conducted once in 2 years or whenever the vacancy occurs. And the level of exam difficulty, this is more important. The Neet PG and INI-CET, these exams are kind of more difficult compared to the other two that I have mentioned. These exams at least require a preparation time of 9 months. Basically, between somewhere around 6 months to 12 months, averaging 9 months of preparation. UPSC and ESIC exam, whereas you can prepare it in 3 months time because the paper is of average difficulty, and it is not the same level of difficulty as seen in Neet PG or INI-CET exam. State exams, they're also kind of average difficulty paper, and the preparation time is 3 months. This is the exam difficulty and the preparation time, why it differs, so that we are seeing now. So if you see the exam pattern, in Neet PG INI-CET, we'll have 200 questions, and the questions are from all 19 subjects. So it kind of takes a lot of time to master all those 19 subjects. So we'll need at least a good 6 to 12 months of preparation. Whereas in UPSC and ESIC, only the final year subjects are asked. That is the medicine, surgery, pediatrics, OBGYN, and PSM. However, certain other topics are also incorporated into these subjects. UPSC will have 240 questions. It has 2 papers, paper 1, paper 2, each paper containing 120 questions. ESIC will have 2 papers, paper 100 questions, paper 2 100 questions, so 200 questions. UPSC has 240 questions, ESIC has 200 questions. And both these exams test you on the final year subjects. The state exam varies from state to state. They might have exams, a written exam for 100 marks, then have interview, and the exam difficulty is also of average. and mostly the final year subjects are tested there as well. The qualifying process for Neet PG and INI-CET, as we all know, we'll have this exam and then we'll have this counseling process by MCC. And for this UPSC and ESIC, we'll have a written exam, and then we'll be going to Delhi to attend the interview. Only if we are selected in written exam and interview, we'll get kind of a cut off, adding both written exam mark and interview marks. So based on that mark, you'll be selected. State exam also the same. You'll be having a written exam and then you'll have a personal interview. Only then you will be selected. However, it differs from state to state. Now coming to work life and salary. The work-life balance in Neet PG INI-CET depends on the specialty. Certain specialty you can have a good work-life balance, such as radiology, dermatology, kind of ophthalmology as well. Certain specialties demand more time. For example, like medicine, surgery, those kind of subjects. However, in residency, you're not going to have the work-life balance because the 3 years of residency is quite hectic in this Neet PG INI-CET exams. For UPSC CMS and ESIC exam, the work-life balance is quite there because in these kind of work, you will have basically 9 to 5 jobs, and the work patient load is also not very much. You will be having a very good work-life balance. You will be getting weekly offs, and the quality is good. For state exams also, the work-life balance, yes, very much is. Most of them will be posted in PHCs, where you will be having work only till like 6 to 8 hours, and you'll also get a good salary as well. But the patient load might be varying from each PHC center. Job satisfaction in Neet PG INI-CET, yes, but in UPSC, I would say it's not really true because certain cadres in UPSC will have more of non-clinical academic works, and it will have very less patient load. Cadres, what I mean by that is, whenever you are getting selected in UPSC CMS, you will be allotted in each category or cadres. For example, you might be allotted in railways or central government health service, or you can also be allotted in municipal corporation of Delhi dispensaries. Those kind of, you'll be allotted into separate cadres, but each cadre it varies actually. For example, sometimes in railways hospital you might not have a lot of patient load and you'll have to do more of academics. In certain railway hospitals you will have a very good patient load, but so the job satisfaction, I would say it's not really there. And state exams also, you're being posted in a PHC, and most of the time you will be doing all the clinical works. So when I inquired few people, they told that the job satisfaction is there. Prestige and fame in Neet PG INI-CET, yes, because you'll be doing MDMS fellowship after doing your after giving this exam, and you'll be doing your super specialty. You'll be growing. In UPSC and ESIC, you don't have that really, because you're being limited to your assigned centers. However, after joining UPSC and ESIC, you can work for some time. Then you can come out, do your Neet PG exam. You can do your specialty, and then you'll have to come again and join in this UPSC, ESIC. If not, your job at UPSC and ESIC will be terminated. For state exam, the prestige and fame is not really, I would say, because you're also being limited to your assigned center. However, for UPSC and state exam, you'll have these service points. For example, if you are serving in the peripheral PHCs, if you give your Neet PG exam, you might get extra points for your service. Extra earnings in Neet PG INI-CET, yes, because just you'll be doing your practice as well as you can do teaching, you can have your private clinics and whatnot. But in UPSC and ESIC, you're not allowed to have private clinics, but instead you will be provided additional funds such as non-practice allowance funds and house allowance, many things. In state exam also, it's the same. You can't have your private practice. It's like kind of a government job. You'll have to stick to the government. The salary for Neet Pg and INI-CET, sky's the limit, but it is kind of unstable. So whenever, for example, in a corporate hospital, if they think that you're not good enough, you can be terminated anytime, even after working there for 5 to 6 years. But in UPSC and ESIC, you will have a fixed salary with little increments each year, but it is very stable. And in state exams also, it's the same. You'll have a fixed salary with increments each year, but the salary is fixed and you will get it on time. So basically, in UPSC and ESIC and state exams, the crux of this video is that you will be having a very good work-life balance with 9 to 5 jobs, and you will be getting salaries on time. You will be provided non-practicing allowance, more salaries, and you will have a cool, calm life. But in Neet PG INI-CET, it depends on your department. Sometimes you can go into hectic departments even after doing PG. When you are working as a consultant, your life might not be as stable as others. So you'll be running on emergencies, those things. However, certain departments doesn't have any emergencies. So it's a kind of mixture. So basically, the thing here is that Neet PG exam is not equal to UPSC, because UPSC exam is kind of lesser considered, because it is not going to provide you any additional degrees. It is just a kind of work permit. So those kind of exams is always compared lesser to Neet PG, because in Neet PG you are having a career growth, and you'll be doing MD, MS, and your super specialty fellowship. So that line is different. But people who do not want the hectic life, they can choose this UPSC ESIC exams, and they can also choose this state exams. So this is just a comparison from my side, and I'm not saying that you can go for UPSC instead of Neet PG or go for Neet PG. It's completely up to you. This is just a basic idea about these 4 or 5 exams that I've given here, and you are the person who is going to choose which one you will be perfectly fitting into. So all the best for that, and if you still haven't subscribed to your channel, please do subscribe. I'll be coming up with more and more interesting videos. Thank you.